Okay, we're going to get started just about now. Welcome to another edition of our Advocate webinar series. For those that didn't hear it the first time, my name is Stephen Schultz, Director of State Legislative Affairs in the western portion of the United States, filling in for Julie today. Today we have a fantastic webinar in regards to legislation across the nation, giving you a state update on today, September 20th, 2017. Just so that you know who's going to be doing the talking today, I introduced myself. You have my email and my Twitter account. We're pretty active as far as the advocacy staff here for the Arthritis Foundation, and the person that's going to do the majority of the speaking today is Michelle Guadalupe, Director of State Legislative Affairs. So you can see her email and her Twitter account. She oversees the state directors like myself all across the country and has a fantastic idea of what's going on all across the nation.
All right, Stephen, thank you so much, and thanks everyone for being on the call today. We have our goal, one of our goal statements, and just wanted to kind of share that with you, is to make sure that all people with arthritis have access to optimal care and game-changing medicine while making each day another stride towards a cure. And it's really exciting that we get to work with all of you and that we have such an amazing field team like Stephen Schultz, who works out on our western coast. I did want to share with you our field map just to make sure, like some of you I know might be a little bit newer to our program, but I wanted to make sure on the next slide that you can see, who's covering what in the country. And if you haven't had an opportunity to meet them, we definitely want to make sure that you do in the future. So you'll see, Stephen on the West Coast. We have our newest staff member who's working the middle part of the country, Courtney Kowalski. We have Pam Fields, who works a lot of the Great Lakes area. We have Ben Chaddock, who's also our state policy director, who's up in the Northeast. We have Claudia Stewart, who works in the Southeast. And then myself, my home office is in Illinois, so I still cover a couple of the Midwest states in addition to, working with our fabulous team all across the country. So if you haven't been introduced to your local person, make sure you jot down their email, and I know that they all would really like to hear from you and see how we can get you more involved. All right, so now that we have our introductions and our contact information out of the way, let's get to the kind of start talking about our advocacy program. So there are more than 150,000 advocates. This number continues to grow, and we are so excited that we have that many. We have 1,300 ambassadors. I know we've had some past calls where we've had ambassadors speak, and you may have learned a little bit about the program, but those are some of our most dedicated advocates, and they have assignments that they do, and they really establish those relationships with their legislative assistants, with all of the members of Congress and at the state level. If you do want to get more involved with our ambassador program, we would love to have you, and we'd love to get you signed up for it. Just this year, or just at the end of 2016, we ended up having 40 platinum ambassadors, and that was our highest number, and it just really shows how much our program has grown. And in terms of state-specific laws, just in the past 4 years, we've been able to enact over 73 state laws in more than 40 states. And actually, you can just see on the next slide how it looks all across the country, so you can see where a lot of our victories have been made. And this slide actually had to be updated earlier this week. We had the newest victory happen in Illinois, where some fantastic partners of ours, we had worked with them to have a network adequacy bill passed and signed by Governor Rauner. And what that means is how frustrating is it if you are on a health plan and you look up and say, okay, good, my rheumatologist is covered under my plan, or maybe my physical therapist or another healthcare provider. When you go to make your appointment, you find out that, oh, guess what, the directory actually wasn't updated. So this will be a real patient protection in Illinois, and we were excited to add it to our list of victories just recently. This one now will kind of give you just kind of the picture of just this past year. I love that previous slide because it can show where we've been the past 4 years. This will really kind of hone in on, what we've been doing over the past year and how all of this was made possible because of you. So look at this map. Hopefully everyone can see, but we do have it listed where the B stands for biosimilars and on down the line. So we had a tremendous, victories this year with our biosimilars, and many of these states we actually had an advocate and or one of our healthcare providers provide testimony. And I know myself, in talking with all the field team members, the testimony from our advocates really had a huge sway in how legislators voted. And that's the case in biosimilars. That was the case in our out-of-pocket bill that was passed in Washington, D.C., our step therapy bills in Iowa, West Virginia, Texas. We had people, not only did they go and testify, but we had some media that happened. In Texas, we had a great op-ed by one of our juvenile arthritis moms that hit many of the major papers. So all of these different efforts have really helped, and that's why we have received all of these victories. So I kind of mentioned a little bit about some of our advocate testimony. I just wanted, actually first talking a little bit about our legislative visits. So our advocates were in the Capitol. We were meeting with legislators. So you can see here sometimes it's hard to identify who the legislator is or who the legislative staff person is. But usually a good clue is if you see, you can see some of our Arthritis Foundation advocates in our Arthritis Foundation green. Usually the legislators are in the suit and tie. So you can see where many of our advocates had success and were meeting with a lot of their legislators. So in addition to legislative visits, we had advocate testimony. What was pretty neat is sometimes us in the field, we weren't actually able to be at the hearing. So we relied a lot on our advocates, and boy, did you guys deliver. We were actually able to see some of the testimonies through the computer. Some of them were live streamed. In other cases, like the one in the upper right, you'll see Stacey Penner, one of our Platinum Ambassadors. That picture was actually taken by a legislator, and she shared it with Stacey, and then we were able to get it. So you can see that you all are, just, as Stephen said earlier, rocking and rolling and getting, your faces out in front of our legislators, and it's really turning out that we're having those legislative wins. I got a few more pictures up here. All of you know this. I just want to make sure to reiterate that advocate testimony comes in all ages. We had, young adults. We have the young boy in the middle who was 5 when he testified. Last year, we also had some young advocates testify. Allie Johnson was a senior in high school when she testified in Nebraska. So again, all of these are really making that difference, and we've had such an incredible year because of it. In addition to advocate testimony, the great thing is when we are able to have bill signings, that, all the hard work, all session long, we've actually been able to get many of our advocates to attend these bill signings. And here's just a couple as an example for all of you to see. State Capitol Days, I know many of you on the phone may have gone to these. We actually held 7 State Capitol Days in 2017. And through this, we were able to meet with over 200 legislative offices, which is pretty cool. Everyone that went to these 7 Capitol Days, you definitely had your tennis shoes on, and you were making a difference. What I've heard repeatedly from legislators, what we've heard repeatedly from them, is it's the constant, all the different points that they are reached about a particular legislation. So we may have had some advocates who attended, a hearing, and, and were able to testify. We may have had other advocates go to a Capitol today. We may have had other advocates who just made phone calls or met with legislators in their district. But what we heard is the constant, opportunities that these legislators heard from our advocates, and that's really what sways them, and that's really, they're like, wow, okay, this really does matter to my constituents. So 2017 isn't completely over. There might be still some opportunities, some legislative action. We actually, just today, I had an update that in Utah, one of our Platinum Ambassadors and a few other of our advocates actually testified during a hearing on step therapy. So kudos. I don't know if you're on the phone, you might be traveling back, but that was just another opportunity for our advocates to get in front of folks. I also know that we have had some of our field team in Ohio today working on step therapy with some other patient organizations. So even though the majority of our, many of our legislative sessions are in recess, there are still some of our active states. All right, so I just gave you kind of a nice synopsis of what we have done so far in 2017. So I just wanted to give you a preview on our 2018 state advocacy. Many of you participated in an advocacy survey that went out at the end of last month. And in fact, we had close to, I think it was a little over 1,600 of you responded, which is really exciting. And so we just wanted to share just a couple of those survey points. And then we will definitely be utilizing those survey results as we are continuing to plan our 2018 year. And then, of course, just expanding our state advocacy is our second piece. All right, hot off the presses, here's a couple highlights from our survey. So really looking at our top 3 advocacy priorities, many of you mentioned research for a cure, managing chronic pain, and access to insurance coverage and providers. Financial concerns on medication affordability, that was really high up there. And many of you had indicated that prior authorization requirements and also those access to providers were cited as top access issues. So really what we want to do is, these are just some of the highlights in the survey. We are also going to be looking at the survey because there were a lot of state-specific information that we gathered. We're going to be doing some different targeted state priority setting that's really going to be specific to your state. And I know I had introduced all of our state directors at the beginning. We will definitely be, doing specific targeted outreach to the states as we are moving forward in 2018 and really expanding on some of those priorities. All right, so what are we going to do in 2018? This is state advocacy specific. So we definitely want to continue reducing barriers to patient access. As you saw from our map at the beginning, we talked about how we had 73 legislative victories for the past 4 years. That included biosimilars, that included looking at legislation on out-of-pocket costs, curbing step therapy, looking at mid-year formulary changes. These are all items that we will continue to be working on. And in fact, we are doing quite a bit of planning with many of our different external partners. There are many patient provider groups. We all work on these different issues together. And really, we would then work with all of you to have that arthritis perspective, and then some of our other partners, they will be finding stories in their particular disease state. So having all those collective voices is what really helps us go through the finish line. We will be something a little bit newer that we're going to be working on going into 2018 is many of these patient protections are now going to be coming into effect. So I know that we've had some victories go into effect, more that are going to come in January. Many of our step therapy laws, as an example, Iowa, Texas, these are going to be starting where the protections can start happening in January of 2018. So we want to make sure that you all are armed with the information so that you yourself knows what that actually means in your state, as well as being able to be advocates to others and wanting to make sure that all of the healthcare providers are aware of these patient protections. Another one is connecting all of you with some of our local opportunities. We definitely are going to continue with our state capital days. We are still determining where we're going to be having those state advocacy days. We really look at where our legislative action is going to be, and really wanting to have those kind of targeted efforts so that we can really have good success in getting our patient access bills getting signed into law. There's also different training opportunities. You all are on one right now. You're learning about what we've done in 2017, and you're learning about just a quick snapshot about what we're looking at in 2018. So we'll be continuing to do some of those more national trainings, as well as looking at issue-based trainings, and many of these will be able to be done right from the comfort of your home, as I know we are all so spread out, but making sure that we arm our advocates with these different opportunities. So I talked a little bit, about what we're doing in 2018. I know I kind of made a plug for the Ambassador Program earlier in this webinar series, but we definitely do really recommend that you, if you haven't already, that you join this program. It's really an opportunity to get more of that training, so that you could be, just a great advocate for us, and really getting out there to have those relationships with all the health legislative offices. We will continue to have issue-related advocate training. We want you to build those relationships with key policymakers. We need your help in making sure that you sign up your friends and family as advocates. It was really exciting that we now have a new database for our advocacy program called Voter Voice. I know that many of you have heard about this program, but what we really want with that is ease of being able to, report assignments for our ambassadors and to take action on any particular action alerts that we would have. And of course, as always, to tell your story. If you haven't gotten to know your local state director of advocacy, I recommend doing so. If you have a story, like you've had trouble accessing your medicine, but maybe you don't know if it's, what issue, if it's step therapy or if it's prior auth. I know a lot of these terms might be a little bit new to some of you on the folks, but just let us know. If you can't get your medicine, if your child can't get your medicine, you can't afford to get your medicine, these are all things that we need to know about. Stephen, I'm going to turn it back over to you to see if we have any, because we definitely have time for questions.
Perfect. Thank you very much, Michelle. I'll just, this is a perfect time. If you wanted to hit #6 if you want to ask a question, or you can always use the chat feature of the WebEx. But yeah, like Michelle said, it's a great time to be able to ask any questions that you may have.
I just want to reiterate that we are just thrilled that, we are just continuing to grow our advocacy programs, and we, again, find our advocates and ambassadors who will testify for us, meet with their legislators. Again, you guys are the reason why we've been so successful, and we are just really excited to get the ball rolling with 2018 and to get many of you involved with us.
I think that's perfectly stated, and I think that's a good way to wrap up this section of the webinar. Just a reminder for what's coming up next. Our next Advocate webinar series will be all about the open enrollment portion that is coming up quick. It's going to be a good reminder, a good way for you to be able to ask any questions that you may have that we could possibly help you about. That will take place on Wednesday, October 25th at 11 a.m. Eastern, so a little bit of a different time. So don't put that in your calendar. We'll have plenty of reminders coming your way as that gets closer, but store that away. And then thank you for joining. But if you have any questions, concerns, Michelle and I are great resources to ask, but Julie Eller, our manager of grassroots advocacy, is a fantastic person, as and always so enthusiastic to answer those questions. You see her email, her phone number, and her Twitter account listed right there. Again, like I said, thank you all for joining us today. If you chew on anything that was stated in this, like I said, don't hesitate to reach out to us with those questions, and we'll be so glad to be able to help. Thank you all for jumping on. Bye.